Welcome back, everyone, to Einstein's Eyes, where John and I discuss all things related to healthcare, particularly ophthalmology, since we are ophthalmologists. I'm oculoplastics, neuro-ophthalmology in Anchorage, Alaska, primarily oculoplastics. Um, we are going to discuss Dupixent today, a game changer in the management of atopic dermatitis and asthma. And the two are frequently associated. While Dupixent has brought immense relief to many, it also comes with some important considerations for eye health. Um, Now, join John and I as we delve into the potential ophthalmic side effects of Dupixent and really what you should be aware of to protect your vision while on this medication. John?
Yeah, it's very interesting. So over the last couple of years, I've seen many people on Dupixent. Early on, I guess I would just add, so just introduce myself. I'm John Ditkoff. Carl and I have been friends, and we also worked together as residents. We did our training at Albert Einstein in New York, hence Einstein's Eyes. So we appreciate you coming on the site. I practice in northern New Jersey. He's over in Alaska. So we get to see each other when we make these videos, which is a lot of fun. Um, and I specialize in the front of the eye, the cornea, the anterior segment. So as an ophthalmologist in northern New Jersey, I've been seeing regularly consultations on people that have been recently put on Dupixent. People love it. I mean, it's really making a difference in their life, really, really. And they come in somewhat anxious because they're told by their doctor, hey, go see an eye doctor. I just want to make sure you're okay. Early on, I was getting a lot of consultations like that, and their eyes were fine. It was kind of a waste of their time. But now I'm seeing less of those and just real consultations where they come in with a problem. They're told by their dermatologist or their pulmonologist or their general practitioner, if you start having any eye issues, go see the eye doctor. So that's important. So the most common thing I've been seeing, before we talk about it, I just going to talk about the mechanism of the medication. So Dupixent's an interesting medication. It's known as a monoclonal antibody. And what it does is it blocks what are called interleukins, which are these special cells in the body that stimulate other cells to do what they're supposed to do. And by doing that, it's really helping these people that have overstimulated interleukins. So they're helping with their asthma, as Carl said, and their skin, like atopic dermatitis. The problem is one of those interleukins, also their normal job, normal maintenance, is to stimulate these cells called goblet cells that are in the eye that produce mucus and kind of help dry eye and help a lot of conditions in the eye. So what happens is the medication is working well, but what happens with the good, some bad. So what happens is these cells don't work well. And what happens is these people start to experience dry eye, conjunctivitis, which is inflammation of the white part of the eye. They can get inflammation of the cornea, which is the front part of the eye. And that's all from the fact that the mucus is not doing what it's supposed to do, which is protect the eye. So in most people that I've seen and that I've read about, it's really not a serious side effect. It's not like you're going blind from this medication in 99% of the cases. It's more they start to feel irritation, inflammation, redness in their eye. They know something's not right. And maybe more in someone who wears contacts, because the contacts already dry out the eyes. But these in people that are otherwise healthy and have no eye problems. So when they go see their eye doctor, the eye doctor needs to have their antenna up. They need to say, hey, what medications are you on? If they're on Dupixent, well, at least we have a reason for it. Now, I've had enough patients now in my little experience to say that we haven't just stopped the medication. Some of those people, I treated them. I put them on lubricating drops. So we have a video about dry eye and blepharitis, so and conjunctivitis. So we treated the inflammation in the eye so that they didn't need to stop the Dupixent because they were so happy with the medication. I have a few patients where they either weren't that enamored with the medication, it wasn't doing such wonders for them, and they didn't really want to have a red eye, so they were willing to stop. And then I have a few patients where their eye was really inflamed. I mean, they were really having problems in the cornea. There's a condition called corneal ulcers, which is more serious, where you can get inflammation in the cornea, can even lead to scar tissue and even potentially loss of vision. So when people are having that type of inflammation, well, then I have a conversation with their doctor, and we have to talk about either lowering the dose, stopping it for a little while. It doesn't mean they can't use it forever, And then maybe what I do then is I get them on some type of preventative, prophylactic type of regime where when they go back on the medication, I'm treating their eyes. So they're less likely to have that inflammation. Um, but it is a wonderful drug. People are really loving it and the benefits. You just have to be a little bit cautious and if you're having eye problems, make sure you see an ophthalmologist. You can see a cornea specialist like me. Hopefully, most of the ophthalmologists out there are aware of this side effect, so they know what to do.
Right, right, right. So just to recap, so Dupixent is for atopic dermatitis, also known as eczema, which is strongly associated with asthma. And some studies suggest that more than 25% of people with atopic dermatitis can develop asthma. Again, associated also with hay fever. Uh, so the folks on Dupixent are probably aware of this, but maybe not as aware of the eye findings. And then, as John said, there are common ophthalmic issues and less common ophthalmic issues that need to be discussed with your ophthalmologist. And we appreciate you being here. It's great to have you and for you to learn more about the medications that you're taking, Dupixent being one of them. We will continue to bring more information to expand your fund of knowledge. And please like and subscribe, and we'll see you on the next one.